I'm Dr. Sandra Yeh. This is a product that I take myself, and sea berry has worked for my patients, and I recommend it to all the doctors that I see and to every patient with dry eye. I've had dry eye since I was 20. I wore hard contacts. I couldn't even wear soft contacts. And then somewhere in the age 50-ish, menopause hit me. My dry eye became about 10 times worse. People underestimate how debilitating dry eyes is, because when I say that I use tears every hour, that doesn't mean I was comfortable. When I used the tears, I was comfortable for about 5 minutes. And you'll hear this very often, because it wasn't so much the tear problem. It was the lipid layer and the mucin layer that was also deficient. And the magic of sea berry is it addresses all 3 layers of the tear film. I went from a tear breakup time of 4 seconds to 14 seconds now. I went from using tears every hour to tears approximately 3-4 times a day. And I use the sea berry every single morning. And it is amazing. We've been treating dry eye all wrong. Now I'm utterly convinced that dry eye is not an isolated diagnosis. It is part of a whole body dryness, and it is part of a whole body inflammatory process. And so I highly recommend this for my patients with any sort of autoimmune disease. All of these conditions inevitably lead to dry eye, either in the beginning or the end or in the middle. So the anti-inflammatory quality is amazing. And no amount of Xiidra, Restasis, or Cequa is going to fix your dry skin, dry mouth, or vaginal dryness. It is wonderful. It's more cost effective. It was less expensive, and it had a model where I can offer it directly to patients through my office. And sea berry is the only thing between the omega fatty acids and the anti-inflammatory process that literally quenches, I suppose, a thirst of dying glands and actually regenerates. It's just amazing.